Do you know what diabetes is and how it affects your body? Let's delve into that. At its core, diabetes is a chronic disease that impacts the way your body transforms the food you eat into energy. When you consume food, your body breaks down sugars and carbohydrates into a special sugar called glucose. This glucose is then used by your cells for energy. However, if you have diabetes, this process doesn't work as it should. Your body either doesn't make enough insulin, the hormone that helps glucose get into your cells, or doesn't use insulin effectively. This can lead to high levels of glucose in your blood rather than in your cells where it's needed. There are several types of diabetes, each with its unique characteristics, and if not managed properly, diabetes can lead to serious health complications affecting not just your blood sugar levels but your entire body. So, diabetes is not just about high blood sugar, it's a complex condition that can affect the entire body. You might be wondering, are there different types of diabetes? Well, the answer is a resounding yes. Let's take a closer look at the two main types, type 1 and type 2 diabetes. Type 1 diabetes, often diagnosed in children and young adults, is a condition where the body does not produce insulin, a hormone needed to convert sugar, starches, and other food into energy. It's a lifelong condition, and managing it involves regular monitoring and insulin therapy. Now on to type 2 diabetes, the most common form of diabetes, often developing in individuals over the age of 45. In this case, the body doesn't use insulin properly, leading to insulin resistance. Over time, the pancreas struggles to make enough insulin to keep blood sugar levels normal. And, not to forget, there's also gestational diabetes, which occurs during pregnancy. It usually resolves post-childbirth, but it may increase the risk of developing type 2 diabetes later in life. Each type of diabetes has its own unique set of symptoms and treatment strategies. What are the symptoms of diabetes and how does it affect the body? Diabetes is a condition that can be stealthy, often presenting no symptoms until it's already done significant damage. But there are signs that can serve as red flags, alerting us to this silent intruder. One of the most common symptoms is frequent urination, often coupled with a seemingly unquenchable thirst. This happens because your body is trying to get rid of the excess sugar in your blood, pulling fluids from your tissues in an attempt to dilute the sugar and flush it out of your system. Another symptom is unexplained weight loss. Despite eating more than usual to relieve hunger, one might lose weight. Without the ability to metabolize glucose, the body uses alternative fuels stored in muscle and fat. Calories are lost as excess glucose is released in the urine. But how does diabetes affect the body? Well, the effects are far-reaching and can impact almost every system in your body. The heart, for instance, is at risk. Diabetes dramatically increases the risk of various cardiovascular problems, including coronary artery disease with chest pain, heart attack, stroke, narrowing of arteries, and high blood pressure. Moving to the kidneys, over time, the high blood sugar levels can cause kidney damage. This often leads to kidney disease or complete kidney failure if left untreated. Our eyes are not spared either. Diabetes can damage the blood vessels of the retina, potentially leading to blindness. There's also a risk of cataracts and glaucoma. And let's not forget the nerves. Excess sugar can injure the walls of the tiny blood vessels that nourish your nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spreads upward. If not managed properly, diabetes can lead to serious complications, including death. It's a silent but deadly disease that requires constant vigilance. Recognizing the symptoms and understanding the effects of diabetes is crucial for managing the condition and preventing complications. So, let's summarize what we have learned about diabetes today. Diabetes is a chronic condition that affects how your body turns food into energy. There are different types, each with its own unique characteristics. Type 1, Type 2, and gestational diabetes are the most common forms, each affecting the body's insulin production and use in different ways. We've also explored the many symptoms of diabetes, which can range from increased thirst and frequent urination to unexplained weight loss and fatigue. It's important to note that these symptoms can sometimes be subtle, making regular checkups vital. Diabetes doesn't just impact your daily routine, it can have long-term effects on your heart, blood vessels, eyes, kidneys, and nerves. If you or someone you know are experiencing any of these symptoms, it's crucial to seek medical advice. Remember, Early detection and proper management can make a big difference when it comes to living with diabetes.